For residents of Kojooku, the siting of a hospital or a health center in the community is a necessity than a luxury. This is because it will help many get access to health care and improve their health outcomes. Many deaths could have been avoided by siting a health facility in the area. There are over 10,000 residents trek miles to neighboring Kaswa or to Gomoa to access health care. For residents, they can only hope that they don't fall sick in the dead of the night, since their chances of survival will be slim as a result of the lack of a hospital. City News sources say over 5 persons have died, including a 9-year-old who was bitten by a snake. They say the 9-year-old could have been saved if they had a hospital. Quite apart from these challenges, the bad nature of the road linking the community to other towns is bad, preventing commercial drivers from plying that community. There have been instances where the lack of a hospital, coupled with the bad nature of the road, has forced some pregnant women to deliver on their way to the hospital, while others have died in the process. Here are some residents of the community sharing their stories with City News.
And I say polyclinic and now Liberia camp. I had a nishi waha.
I will come and cry a bear na Joe 3 o'clock in the moon. Now, can be out soon near. Until me could not copper drive a beach or even Poyako cramp a quano soon. Yes, I'm good to a card and come out. We could do 30 minutes from your way. It is Tankamutum Namoya my yam and Cabeway Empire.
Kwani de nyeba kuba nti ukoka so kura wo fa ka ba ha obi ase won ba nka ka se nsuo piti de ka bia mba ha usi ukokoje ku a we se won ko ukokoje ko we se won ko se je 20 Ghana da nsuo piti on beje be se 100 Ghana.
For this individual who has taken the initiative of wooing investors to build a hospital in the community, this will be a dream come true if benevolent individuals support his vision. At the ceremony to cut the sword for the construction of a hospital project, he urged investors and the assembly to buy into his vision and support the project.
Always we are thinking about government. I'm appealing to those who have it. Shouldn't look on only the government. We are the government. And I promise that when we stand, that we will work in favor of the community. We can do it. We are over 10,000 in this community. We have all the government high rankings in this community. We have them. We have the police. We have the military. We don't even have anything that we say, oh, if any emergency, we will rush on it. This is about 3 or 4 people. In the night, they fall sick. They all die because they don't have the health care.
The Gomoa Health Center is one of the closest facilities where persons from Kojooku visit when they fall sick, but according to the facility, they are sometimes overburdened by the huge numbers that come from Kojooku for health care and believe the siting of a facility at Kojooku will reduce the burden on them. Abuyama Adams is the physician assistant for Gomoa Health Center.
Nyanyano sub-district have a population of 122,235 that we are supposed to serve. The only government health center is the Nyanyano Health Center, and then we are not able to serve all our populace, especially places like Kojooku. At times it's being cut off. The road network is bad. At times when it rains, we are not able to even come and do outreach services. There have been a time that when it rains, the taxis will not be ready to come. If you're looking at our daily OPD attendance, Kojooku people has been coming more than any other communities to the facility. So getting a health facility here is going to reduce the OPD attendance and then the pressure that is on the nurses there. It's a very good initiative that the community people has taken, and we are much happy and we are behind them.
For residents of Kojooku and the Gomoa East district, they are hoping that the siting of this health facility in the community will help save lives. Calvis Tete, City News, Gomoa East.